Elizabeth, you came to the clinic suffering from arthritis in your right knee, having been diagnosed 2 years ago. How did it affect your life on a day-to-day basis?
I was in constant pain. I couldn't walk up and down the stairs without feeling the pain. I couldn't sit and cross my legs. After walking during the day, because my job involves a lot of walking, I'll come home in so much pain. Had to put an ice pack on it, and it was so painful every day, basically.
You said it affected your work. How did it affect your work? What did your manager suggest to do?
It did affect my work because I was in constant pain, but I've never actually missed work because I've got such a high pain threshold. So I would go to work even though I was in pain. And I would tell my manager, because she would ask, how are you today? I said, I'm in pain, but I'm managing. And then she suggested that they will find an occupational health therapist for me, so my employer can get advice on how to change the work for me so that I can manage better with my condition. But then a few weeks down the line, that didn't happen. I was given 3 options. First one was to retire early. Second one was to retire on ill health. And the third one is to join another team, which was not going to help because almost everyone in the building goes out. We do a lot of community work, which surprised me because I hadn't lost any days at work. So I was at work even though I was in pain.
When your x-ray results came back, what was your doctor's plan of action?
They suggested physiotherapy, which I did a few sessions, but that didn't help much. And they said because it's a degenerative disease, I'll have to just manage it with painkillers. They gave me these strong painkillers which cause constipation, and they gave me something else to alleviate the constipation that comes with it. And they said I'm too young for knee therapy, so I'll have just to manage the pain for now until I'm old enough for the knee replacement therapy.
You've had a course of treatment now, and you report your symptoms are reduced by 90%. How's it affected your life in a positive manner? What are you able to do now that you weren't able to do before without pain?
Oh, I'm in no pain at all now. I can walk for about 10 to 15,000 steps a day without feeling pain, because before I would come home in excruciating pain, but now I even forget about it. I can walk up and down the stairs. I can sit and cross my leg. Even when I'm sitting on the train, sometimes I would have to stretch my legs because I would be in so much pain. Now I just forget. I'm just normal. It just feels nice to be normal, to be without pain.
What would you suggest to someone who has come across the treatment on the internet but doesn't know whether to try it for themselves or not?
I would suggest to give it a go, to not go to depend on the painkillers, because this works for me. Even on the very first treatment I got from Oli, my pain was reduced to 50%. It was painful getting the injections because of the inflammation, but when I got home, I could actually breathe. I could tell the difference. It was down to like 50% instantly. So I would suggest don't waste time. Just give it a go and come to Oli. Oli has got patience, and he does his job with passion.
Thanks, Elizabeth.
Thank you.